It's not just from wearing the wrong shoes. The lesser toes, 2, 3, 4, and 5, contain two joints that allow them to bend at the middle and tip. Hammer toes occur when the middle joint becomes flexed or bent downward. It's important to consider and know the difference between causes and risk factors for hammer toes. Hammer toe causes include toe injuries, arthritis, a high foot arch, poor fitting shoes, tightened ligaments or tendons, and pressure from a bunion, which is when the big toe turns inward towards the second toe. Risk factors for developing hammer toes include family history, chronically wearing tight or pointed toe shoes, and having calluses, bunions, or corns. Over time, wearing tight or poor fitting shoes can increase your risk of calluses, bunions, and hammer toes. Correct footwear, cushions, pads, and insoles are often first-line treatments. Surgery is usually an option if all that fails to provide relief.